Thank you, Dean Liu and Pariksha, and thank you, Mom and Dad. Good afternoon, faculty, family, friends, and fellow members of the class of 2025. Today, we celebrate the 80th commencement ceremony of the UC Berkeley School of Public Health and recognize the dedication and excellence of another exemplary batch of Berkeley public health leaders and changemakers. Congratulations, Bears. Today truly feels like a full circle moment for me. 8 years ago, I sat on the same stage at my undergraduate commencement ceremony. Since then, the world and I have both changed in significant ways. Some changes have been remarkable and exciting, and some have been painful and challenging. But this campus still gives me the same comfort and hope even 8 years later. Berkeley has taught me so much, and what it couldn't teach me, it prepared me to learn from the world. One of the first things I learned at Berkeley was how to fail. I will never forget sitting in Latimer Hall, crying in the middle of my organic chemistry midterm, trying not to let the tears smudge my sad little carbon ring drawings. I've wanted to rip my hair out debugging R code, or trying to understand the difference between the Beveridge and Bismarck models of healthcare. Let me tell you, failing is not fun. But Berkeley taught me that failing is a privilege. Failure means that you have finally made it to the boundary between what you know and what you have yet to learn. It is the ultimate sign that you are growing. The second most important thing I learned at Berkeley was how to listen. And not just listening in lecture halls, but listening to speakers at student protests on Sproul. Listening to stories of pain, resilience, joy, and growth from our classmates in discussion sections. Listening extra hard for the voices that are silenced and suppressed. History has shown us that times will come when people with a lot of power will try to tell us to stop listening to each other. They will talk over our voices and tell us what they think we need to hear. My fellow Bears, don't fall for the trap. Remember, this campus is the birthplace of the free speech movement. Keep your ears, your hearts, your minds open. Keep listening. Pay attention. Bear witness. Berkeley has helped me achieve my dreams. I knew since I was a little girl that I wanted to be a pediatrician. I deeply appreciated the way that my own pediatricians empowered me to ask questions and advocate for my health and body, even as a child. During my training in pediatrics at Kaiser Oakland, I rotated through clinics, wards, and ICUs, learning from and caring for the children of my East Bay community. I learned to diagnose common pediatric conditions and identify what was causing a child's symptoms. I learned how to come up with treatment plans and how to counsel patients and families. But I also encountered questions that I did not have the ability or knowledge to answer. I embraced a tired mother in the NICU as she asked me why her child was born prematurely while we stood over the incubator watching as a ventilator helped her baby girl breathe. I sat with a family, tears streaming down our faces as they asked why their son's cancer had relapsed when they had celebrated the joy of finishing chemotherapy just a few months prior. I rubbed a teenager's back helplessly as he asked me in frustration why the pain of his sickle cell crisis just wouldn't go away. I did not have the answers for these questions, and to some extent, neither did my medical textbooks or my fellow physicians. But this discipline, the study of public health, can help us understand these whys. In my public health classes at Berkeley, my classmates and I have traveled upstream and considered the implications of environmental injustice, racism, sexism, poverty, education, disability, policy, law, war, genocide, occupation, famine, and human rights on health. We have sought to understand the invisible forces that allowed for the devastation of the COVID-19 pandemic. From the tiniest single nucleotide changes in the genome to the enormous global emissions of greenhouse gases, we have sought to understand why disease occurs, why it affects specific communities differentially, and why it is our responsibility to address these structural determinants of health. So as a physician, I would like to thank you, all of you, from the bottom of my heart, for your perseverance and dedication to answering the whys. Your contributions as public health leaders are incredibly valuable to real people, communities, families, and children around the world, and they will benefit directly from your work. Truly, thank you. In closing, I'd like to share an excerpt from Palestinian-American poet Naomi Shihab Nye's poem, Famous. I want to be famous in the way a pulley is famous, or a buttonhole, not because it did anything spectacular, but because it never forgot what it could do. Fellow Bears, never forget what you can do, because you will all do truly spectacular things for the world. Remember that health is not just the absence of disease. Health is flourishing, thriving, growing, and laughing, freely, safely, and in community with each other. Let our diplomas be our calls to action. Let us do small things with great love, and let us truly live out our motto, Fiat Lux, let there be light. Thank you, congratulations, and go Bears!